You know, it can be really scary when a loved one gets sick, and when it comes to strokes, seconds count in getting help.
Dr. Sanjay Mittal is the medical director of UConn Health Stroke Center, and he's joining us now with some important information that's a good idea to know before something happens. Doctor, thank you so much for being with us.
Thank you.
Can you tell
Glad
us,
to be here.
Thank you for coming on the show. Can you tell us this, first of all, what are the signs of stroke? How would we recognize if someone was having a stroke?
Yeah, so there are several symptoms of stroke, but most common symptoms are bunched into an acronym called BFAST, where B stands for somebody who has acute onset, sudden onset, trouble with balancing themselves. E stands for eye, so if there is any vision problem, they have trouble seeing or they're seeing double. FAST, face, arm, speech, time to act.
Okay.
So if the face is twisted to one or the other side, if arm is weak or even leg is weak,
So if
the speech is altered, they are not able to express themselves, so they are not able to understand what is being said or asked of them, it's time to call 911 and initiate the stroke alert process so that a time-sensitive treatment can be administered to the patient and prevent a lot of disability that otherwise would come to a stroke patient who are not properly treated.
Yeah. So we always hear time is brain. I remember interviewing a woman who was a mom, and she asked her daughter to Google the symptoms of stroke because she didn't want to take the chance to call 911. She was having a major stroke. We don't want to guess, right? No one's going to be mad if you go to the hospital and it turns out it's not that. You really just want to get help as soon as possible, and that means calling 911 right away, right?
That's correct. It's better to get patient to a 911 system rather than driving patients themselves. There is enough evidence to suggest that people who have acute strokes and they do not use ambulance, but they drive themselves or their loved ones drive them to the hospital, they are less likely to get the proper treatment in a timely manner.
That's interesting.
While the hospitals are actually geared nowadays for receiving patients who are having acute stroke symptom and expedite their evaluation and treatment. So patients coming by ambulance who are having stroke are most likely to get appropriate treatment, which includes clot busting medication as well as removal of the clot by a catheter.
And we're pretty lucky to have UConn Stroke Center right here in our state, right, Doc? I mean, it's a pretty incredible place.
UConn Health Stroke Center is a primary stroke center. We are Joint Commission certified stroke center since 2014. And as of today, we offer all the modern stroke treatment which is available or recommended. UConn Health is proud to say that patients who come within 3 hours of their symptom, 90% or more patients will get the clot busting medication within 60 minutes, which is one of the benchmarks from the Joint Commission and American Heart Association. And any patient who comes with a visible clot in one of their major arteries in the brain, we immediately take them to our hybrid OR room and the clot is removed. And we have had very good results lately with our thrombectomy or endovascular treatment patients.
Doctor, thank you so much for coming on, because it's just important for everyone to know the symptoms and to know that there's a great place to go. We want to thank you for being here and let everyone know they can visit health.uconn.edu to get some more information. Thank you so much, Doctor.